Thanks very much. This is actually kind of a supplementary to Senator Boisvenou's question, because I had the exact same extreme concern when you started to speak about this. And Ms. Madison, I have your position listed here as Director, Office of Drug Policy Controlled Substance Directorate, and Ms. Gonçalves, you are listed as the Director General, Controlled Substances Directorate. And Ms. Wan, you are legal counsel. So did any of you recommend to your superiors, to your department, to the government that this terrible scourge, fentanyl, that this important step, as thankfully Senator White has provided this senator's bill to do this, but did any of you recommend to your superiors, to the government, to the department, that this important step be taken to curb the use of this terrible scourge on Canadian society, which has been known for quite some time that this has been a terrible scourge?
Yes, thank you. As I said, as I started to explain before, I think we do monitor these substances and the use of these substances very closely, and we work with law enforcement to identify them. The question of timing in terms of actually moving forward with proposals to actually deal with the precursor issue and the use of fentanyl itself, we were actively studying. And we were actively reviewing what the options were to actually deal with it. In terms of timing, I think Senator White sort of proceeded more quickly than we were able to, but we were definitely looking at this issue in detail.
Okay, looking at this issue, but I mean, this has been in the news for quite some time already. I mean, I've just watched a Law and Order episode about it, which was a fairly old repeat, where they talked about the scourge of fentanyl. So did any of you personally, yes, obviously you're studying all these different types of drugs that are so quickly modifying and becoming more and more dangerous now with the brand new drug that's been talked about in the news lately, but did any of you personally recommend this needs to be done, not just studying, like let's move?
Yes, we were in the process of doing that. And
Senator White's bill, it's just quite recent. I mean, it was only introduced in the chamber, I don't know, just in the last couple of months, I think. So you were taking steps before that other than studying?
I mean, I can speak to, so our directorate does look and make recommendations for all of the schedules under the Controlled Drugs and Substances Act. So we have an internal structure where our scientists do environmental scanning and look for problems and build evidence and then bring them and discuss them as a group and set priorities. And then those recommendations move through the system. So I think this is where we can say we're often studying a variety of substances and their precursors. And it's a question of gathering all the data, meeting our criteria for having a robust evidence base and moving it through the system. So there's an ongoing process.
Given the length of time that it's taken to move on this, would you suggest that perhaps that system, which sounds quite bureaucratic, needs to be flattened out?
I guess maybe what I can provide is a couple of examples where there has been a heightened degree of attention and pressure and items have moved faster. So for example, a few years ago when we added the bath salts to the schedules, and most recently when we moved to Schedule W18 and added as a controlled substance, those are two examples where the system can work quickly when there's an urgent public health and safety need. And in this case, these substances were following more of the regular process.
With that many deaths?
Thanks.